1. What is the correct CPT code for a laparoscopic cholecystectomy? A. 47600, B. 47562, C. 47570, D. 47550. 2. Which modifier should be appended to indicate a separate, significant EM service by the same physician on the same day as a procedure? A. -25, B. -51, C. -59, D. -24. 3. Which ICD-10-CM code is appropriate for type 2 diabetes mellitus with diabetic nephropathy? A. E11.29, B. E11.21, C. E11.22, D. E11.9. 4. What is the purpose of the ICD-10-CM excludes one note? A. Indicates synonyms, B. Lists optional codes, C. Identifies mutually exclusive diagnoses, D. Suggests additional codes. 5. Which HCPCS Level 2 code is used for a walker with wheels? A. E0100, B. E0135, C. E0143, D. E0156. 6. What is the correct coding for a new patient office visit with a detailed history, detailed exam, and moderate complexity MDM? A. 99201, B. 99202, C. 99203, D. 99204. 7. The root operation excision in ICD-10 PCS refers to A. Cutting out all of a body part, B. Cutting out part of a body part, C. Tying off blood vessels, D. Destroying a body part. 8. In medical terminology, myalgia means A. Muscle weakness, B. Muscle pain, C. Joint inflammation, D. Nerve pain. 9. Which modifier is used when a service or procedure is discontinued after anesthesia administration? A. -53, B. -52, C. -74, D. -76. 10. A patient receives chemotherapy through a centrally inserted tunneled catheter. What CPT code is appropriate? A. 36558, B. 36556, C. 96413, D. 96415. 11. What is the correct diagnosis code for essential primary hypertension? A. I10, B. I11.0, C. I12.9, D. R03.0. 12. Which CPT section uses a 5-digit code followed by a description of services provided? A. HCPCS Level 2, B. CPT Category 3, C. CPT Category I, D. ICD-10 PCS. 13. In what order should multiple procedures be coded when modifiers are not used? A. By date, B. Alphabetically, C. By complexity, D. Highest to lowest RVU. 14. What is the term for inflammation of the liver? A. Hepatitis, B. Hepatomegaly, C. Nephritis, D. Gastritis. 15. Which code set is primarily used to describe supplies and equipment? A. ICD-10-CM, B. CPT, C. HCPCS Level 2, D. DRG. 16. A diagnostic colonoscopy is coded as A. 45378, B. 45380, C. 45385, D. 45391. 17. Which of the following is a covered entity under HIPAA? A. Employers, B. Patients, C. Health plans, D. Software vendors. 18. What is the primary function of an NCCI edit? A. To allow payment for bundled services, B. To identify coding guidelines, C. To prevent improper payment of services that should not be billed together, D. To determine DRG classification. 19. What body system does the term nephro- refer to? A. Nervous, B. Endocrine, C. Renal, D. Muscular. 20. CPT Category 2 codes are used for A. Reimbursement, B. Reporting performance measures, C. Experimental procedures, D. Evaluation of outcomes. 21. A physician documents closed treatment of a midshaft femoral fracture without manipulation. What is the CPT code? A. 27500, B. 27506, C. 27507, D. 27508. 22. Which code describes a problem-focused history and exam with straightforward MDM for an established patient? A. 99211, B. 99212, C. 99213, D. 99214. 23. What type of modifier is LT? A. Pricing modifier, B. Informational modifier, C. Anatomical modifier, D. Surgical modifier. 24. What CPT code represents bilateral screening mammography? A. 77067, B. 77066, C. 77063, D. 77059. 25. Which code should be reported for administration of one intramuscular vaccine? A. 90460, B. 90471, C. 90472, D. 96372. Certified Professional Coder. The Certified Professional Coder CPC exam, administered by the AAPC, is a nationally recognized certification test that evaluates a candidate's knowledge of medical coding principles and guidelines. It assesses proficiency in assigning accurate CPT, ICD-10-CM, and HCPCS Level 2 codes across a variety of clinical scenarios, including surgical, diagnostic, and outpatient services. The exam also covers topics like medical terminology, anatomy, compliance, and coding guidelines. Earning the CPC credential demonstrates that an individual is capable of reviewing clinical documentation and assigning the appropriate codes to ensure accurate billing and reimbursement. It is widely regarded as the gold standard for physician-based medical coding professionals. Here are the top 5 beneficial uses of the sample exam. 1. Validates professional competency. The CPC exam confirms a coder's proficiency in accurately interpreting medical documentation and applying correct CPT, ICD-10-CM, and HCPCS Level 2 codes, boosting credibility and trust with employers. 2. Enhances career opportunities. CPC certification is widely recognized in the healthcare industry and often required for coding roles, increasing job prospects in hospitals, clinics, and insurance companies. 3. Increases earning potential. Certified coders typically earn more than their non-certified peers, as employers value their validated expertise and efficiency in billing and compliance. 4. Improves coding accuracy and compliance. CPC training strengthens understanding of official coding guidelines, reducing billing errors and the risk of audits or claim denials. 5. Supports professional growth. Achieving certification fosters ongoing learning, prepares coders for advanced credentials, and establishes a foundation for leadership roles in medical billing and healthcare administration.